Yeah, welcome to Three-Step Mask Strategy webinar. And it is, again, a discussion. And so please unmute yourself to ask questions, even challenge the speakers. And the format is going to show up here on the next slide. Yeah, so first of all, we're fortunate to have a presentation by patient Knowhow on survey of the mask use and practice. We're then going to go into recent market analyses and then into the three-step program. So the webinar is a discussion, so please ask questions or challenge speakers whenever you can contribute. And keep your phone on mute, otherwise if you're not speaking. So if you've got any questions, certainly about the procedures, Ross Ardell is with us and can answer those as well. That being said, I think the next thing we want to do is to go to Sri's presentation, which I think is quite going to be quite informative, and so we're going to bring that up here right now. And Sri, the floor is yours. We'd like to hear about this survey. Yeah, sure. Yeah. I see you're still on mute. Let's see. Should we unmute him here? Or?
He's self-muted.
Yeah, you're self-muted still. Sure. Yeah. So if you hit the microphone button to unmute. Yeah, let's see if other people are having that same problem. Yeah, I'm connected.
Okay, I was able to do that just now.
Oh yeah, okay.
Yeah.
Sorry.
Yeah, it's
sorry.
not allowing me to unmute until just now.
Oh, okay.
Yeah, so I'm here. Thank you.
Well, thank you for offering to present today. So we're anxious to hear about this survey. So tell us about it.
Certainly, yes. And first, let me start off by saying thank you, Bob, for assembling this forum here for a number of like-minded people to be meeting and debating these topics. It's a really amazing amount of information that's come through this your program, and that I would have otherwise found out about. So I'm very happy to be here. Yeah. So so you want me to tell you about the survey first?
Yeah. Why don't you go into this survey? That's great.
Okay. Sure. The survey was intended to really understand what is happening in the United States with respect to masks usage, as well as the type of mask that people are using. Because it's kind of like a little bit. I'm not sure if there's any. There have been surveys over the period of time done by different organizations. With the like the Pew survey from August. There's one by
Yeah,
Oh, okay. Sorry. Did I get muted temporarily?
I think we may have made a mistake here unmuting you accidentally for a second or two, but you're fine now.
Okay. Okay, sounds good. Yeah, so there have been other surveys by Pew and McKinsey and earlier in the pandemic, and things have been changing quite rapidly. And one of the other things that we didn't really know is, how often people are using these masks. And so we wanted to understand that. And the results are that, this is based on a survey across the United States, fielded by SurveyMonkey. It was designed by patient Knowhow. It is of adults. And what we found, of course, which is probably not surprising, is that the number one type of mask people are using is a cloth mask. And I think many of us, are aware that the cloth masks provide some level of protection, but not 100% by any means. And they are believed now by many that they don't provide enough protection to prevent coronavirus, especially in closed, congested environments like where workers are working together, like say a fast food restaurant or a, and maybe even other places with the new variants, they just allow the aerosol tiny particles to flow right through. And so if you look at, we asked specifically what types of masks people are using primarily, and that's the second graph in the chart, in this chart. Could you pull that up on page 3?
Yeah. We'll move down here to the pages, right?
Mm-hmm. So as we found, basically the headline of the first graph is that 3/4 of people say they're using masks daily, which is good. And so if you go to the next graph, following that.
Yeah.
And what kind of mask are they using? And you see that about maybe 13 or 14% report using a N95 type mask, and that we can say is a high filtration mask. You can always have questions: are they wearing it properly? Are they using it all the time when they need to, and so on? But they're fundamentally using what we would believe to be a reliable mask based on experience that clinicians have in not getting infected when they're using it. Pretty robust type of technology with electrostatic charge. And then about surprisingly 20% are using surgical masks. And if they were to, we know that the surgical masks, based on a number of studies, have materials that are protective as the filtration materials, but they are loosely fitting around the face, so they allow the air to go in and out around the face, and so they're not completely as protective. But as Sabrina and Catherine presented last week, as well as the work of others, if you use a fitter to seal up the face, then that actually could be approaching the protectivity of an N95 mask, a well-fitted N95 mask. And in fact, frankly, the same fitters could be used to improve the fit of N95 masks, as it turns out, because the N95 masks don't always fit well, and those could also be, but the FDA is apparently doesn't want to make statements about that. But so potentially in the best case scenario, we could say that you can add 20%, so 14% plus 20% are using high filtration masks, and then some people are using KN95 masks, it turns out, and these are have been flagged as having inconsistent quality control. Some manufacturers seem to do really well. The state of Michigan is handing them out about 3.5 million KN95 masks, it turns out, which was news to me. I only learned that last week. And so they are, so some brands of KN95s apparently are good. Some of them are not. And so if you then add that number, all 4 classes of elastomeric N95 and surgical and KN95, you get about 38% in this survey. So we could say at most about 38% of people are using high filtration masks, but probably closer to 14% in a best case, in a realistic case. And so I think this tells us that we have a long way to go to say people are really protecting themselves when they're walking around, interacting in work or in school or in a number of different scenarios, outdoors, in the shopping mall. And so I think we, as an industry, can do a lot more to close the gap. So that's the bottom line of this survey. This took in late December, so we're planning to track this on a monthly basis or a bi-monthly basis at least. And then the notable thing about this is, why do you use a mask? And so it's the next chart. And so I wanted to understand, do people think of it as protecting themselves, protecting others? There's a lot of talk about the different confusion around what a mask is for. And it turns out the majority of people actually believe that they're wearing a mask to protect themselves from others. And so I think this is not exactly the same message we get from public health authorities or from messaging and research, but I think this is fundamentally, it's not incorrect at all. It's actually a valid approach that people want to buy protective masks. So if they are wearing it to protect themselves, then they clearly can be wearing, the 50% are not wearing, these 50%, most of them are not wearing masks that actually protect themselves. So there's a huge market opportunity for the industry to reach these people and sell them something that does actually give them better protection. And the final chart in the survey is to understand, so how do people use these masks, and are they using them consistently in all environments? And I think as we'll go through in the next article about the 3-step strategy, people in consultation with public health experts, what we came to the conclusion is that really the rule that people need to follow is to prevent the household-to-household transmission, or bubble-to-bubble transmission, perhaps. And the only way really to do that is if people wear these high filtration masks whenever they are exposed to someone who's outside their bubble. So this is kind of a interesting concept, is that you have a bubble or a household, and in most cases the bubble is the household, but in some cases people have extended grandparents and their places, people who they're sharing their bubble with, and anytime one person is exposed in the bubble and gets sick, they're at risk of infecting everyone else in the bubble. So if we can stop the spread between the bubbles, we basically stop the pandemic. And that, I think, is the core idea. And so if people have these, even if they have good masks, but they don't wear them whenever they're exposed to someone outside their bubble, we're still propagating the virus. It'll happen eventually. It's inevitable. So this graph here is showing, we asked, so where do you use these masks? And as you can see, that people immediately respond saying, yeah, I use it at the grocery store. But there are other situations where they say that fewer people are using them, like outdoors in public, with people outside my home. So maybe not even be, outside their bubble even. That was particularly concerning, that only 60% of people are using masks with people outside their home. With people in, so when someone visits my home, now this is perhaps a little ambiguous. We didn't say, is this when maybe people are not having people over to visit their home, but all likelihood, a lot of people are having people visit their home, even just like repairmen or for some absolute need. And I think it's really essential to have good prevention of spread between the households. And so these are areas we're going to be digging into in future surveys to understand a little bit better how people are using these masks as well. But all in all, I think I would like to be in a position where we don't have to do this survey, where people are 100% wearing high filtration masks and using them every time they're exposed outside their bubble. And if we do that, we won't have to see the spread so widely.
Really interesting information. I think it's worth spending a few minutes discussing, even in more depth, Sri. So I think one of the interesting points you made was the bubble. If you bring the virus into your bubble, then your bubble becomes a spreading event. And so if they can be wearing their masks anytime they're outside the bubble and wearing an efficient mask, it is really a solution, is it not? And I guess the question is here, the way people are wearing them now, obviously they're exposing themselves, then they're therefore going to be exposing the other people, in their bubbles. So let's move back to the one before this too. So why do you use a mask? And protecting yourself, I think, is pretty significant, and certainly what it should be from everything we see. And then back on the first one, are the mask types. I think this is a critical point, and some of the others may want to ask questions or something here too. But I think that it shows where we have what still needs to be done. If this is another way to look at it is possibly 38% of the people are now have access to masks that could be high efficiency, but the others 62% don't, and therefore this is the challenge that is out there. Not only educating them, but also making sure that the masks are available. Yeah, did
I,
anybody
I would
else?
say I would say 38% is a optimistic estimate. I would say it's probably, if I had to guess, based on this survey, it's probably closer to 20% than it is to 40%.
Uh-huh.
So, given that many surgical masks just don't have a good fit. I mean, we talked a lot about that last time I was on the call. Without the fit, it's really not going to give you the protection that you need. And even though it does provide some protection, and so that you can basically eliminate the surgical mask if most people are not using fitters. We don't know. We haven't asked if they're using a fitter, and that's something in the next survey we may ask it, so to get clearer. But yeah, so I think it's closer to 20% if anything.
Yeah, and the fact that people are not wearing these masks in all the occasions they have, the bottom line is the effectiveness of the masks, given the types that are selected and the way they're worn and how they're worn and the frequency with which they're worn. Rather than the mask being the major way to stop the COVID spread, it is at best a minor way at the present time. So I think this is a very important survey and brings all this into gives some background and statistics and a way to view all this. So I think that's quite important, and obviously that's the reason you did it. But I'm glad that you were able to do that and bring us up. It seems like it was a very recent survey, right?
That's right, late December, December 1st, and I think whatever dates in that document. But I think also add is there's a very large geographic variation in the United States through these statistics. This is a national survey across multiple different regions, kind of an aggregated view. But there, even within California, for example, there seems to be a difference in Northern California, Southern California, within specific cities even. So one of the things we did was look at instead of looking at self-reported statistics,
Let's see. Did we lose you, Sri, by any chance there?
Yeah, it sounded like his computer audio fed up, went away.
Oh, okay. Yeah, well, let's. Yeah, it looks like he's getting back on again now. Oops, he's still on mute. Yeah, so I think while we're waiting for Sri to get back on again, we'll start on the other, and as soon as he's back on, we'll finish those questions with him. So I don't think, Sri, when you get back on with us there, let's talk some more. But let's move on to some of the recent market analyses right now. And let me just pull this from the current slide. So here we have what was our attempt to try to figure out what the ratio of masks being furnished right now is to the total masks that are needed. And this is something we're right in the middle of right now. And so what we just put in the alert here the last couple of days is a very rough calculation. But what we're saying is that possibly 10 million people are using large numbers of masks. Now, you hear that in a isolation ward that that you could be using 10 or more surgical masks a day and several different N95 masks and so forth. But of 10 million people, there are probably only a few 100,000 people that are actually in that close patient contact on a continuing basis. And so, but if you average those 10 million people, some of whom are only using a few masks comparative to the 240 million. What we did, we said, okay, the base public use is going to be 1 mask per what. We didn't quantify this. We just wanted to do it on a relative basis. And if this is what the public needs, then the people in this high contact group are at least using 15 times as many. And then there might be 50 million people that are first responders or various different things that wear masks, not continually, but they wear them more often than the average. And then you've got about 30 million people that aren't going to be wearing masks at all, small children, and it's so forth. But the point we're trying to make here is that the number of masks that is going to be required versus, tight-fitting masks versus the number of people who are being fitted with them now is considerably more. So it's only about 24% of the masks that are going to be needed are actually being supplied right now. And so I think that this is a ratio here which is all relative, but it gives us an indication of the fact that a lot more masks are going to be required. And so what we're trying to do here is to take these very rough numbers and actually put quantified numbers to them. But we're finding it's extremely difficult when you start with the surgeons and the nurses and go on down. There's a wide variety of practices and protocols, and then all of this is extremely critical too in terms of, say, how many masks, if you're using even in the public, if you're using surgical masks, how often do you change that surgical mask? So, and I might open that up to questions at this point. Did any of you have thoughts on the quantity of masks? Do we need 3 times as many masks as we presently are supplying? So we want to make sure everybody can unmute. And respond to that question. Did somebody want to respond on that particular slide there?
Hey, Bob, this is Lloyd.
Oh, go ahead.
Yeah, go ahead.
Hey, this is Lloyd, the founder of Armbrust American. I really think the solution here is an environmentally friendly mask that's already on the shelves, something like a surgical mask that is already. I mean, we have about 20 million masks right now in our warehouse in Austin, Texas, and I've reached out to other partners. There are about 350 million surgical masks on the ground here in the United States available. Now, a lot of those are Chinese. They're very cheap. We're talking 20 cents a piece. So with something, with a mask fitter, obviously Fix the Mask is one of the better ones. But, with a lot of these sort of like hacks that are out there with the 3 rubber bands that the whole Fix the Mask was built on, or there was an NPR article recently about other things you can do, like putting a cut stocking over the mask. It really does achieve these sort of high levels of filtration. We tested with we have an ASTM PFE machine in our lab, and I tested yesterday probably about 20 KN95s, and on average they came in around the 45% range. There's just not a lot of quality control of those coming into the United States. The KF94s are really good. They consistently test well, but I bought the cheapest surgical masks on Amazon, and they came in at 90% PFE. And this is using actually the NIOSH NACL standard, so it's a lot more accurate. So even the cheapest surgical masks on Amazon come in at 90% PFE, which is above the KN95 masks that I'm seeing. So I really think it's a simple and easy solution. That's the solution that people are going to gravitate towards.
Hey, Lloyd, a question for you on that result about the PFE for the surgical masks.
Yes, sir.
Is that an instantaneous test, or is it an extended multi-hour test like NIOSH requires for the N95 certification? Like, is it durable? Does it withstand? Is it like a stress test, or is it a kind of a quick check?
It's I think we run it for about 120 seconds, and we run it at 85 liters per minute, which is obviously like way more than anybody would normally be doing on a. But when we've tested, we've also tested. So we also are very close to getting our N95 approval. We use the exact same fabrics. It's just in a cup format. We have a molded cup that are like, it's literally, we make our own melt blown material. So we use the same melt blown that we use in our surgical masks. And we just have a cotton shell on it, like a needle punch cotton to give that cup hold. And in the NIOSH tests, we're hitting the same numbers on our material is around 99% pretty consistently. And we're getting the same exact results through the NIOSH test. So I think yes, like there is a difference between the NIOSH standard and the ASTM or the FDA standard, but I think it's percentage points.
Hey Lloyd, this is Dave Rousse with INDA. Nice to be with you again. That test is a sealed down test, isn't it? The edges are sealed.
Yes.
Yeah. So it has no provision for the leakage.
No, that would be a separate test, which is why, like, I'm not arguing that surgical masks are the solution, especially for these for the new variant of COVID that's out there. But I'm saying paired with a reusable fitter is the solution, because the masks, the filter media is out there, and it's like the infrastructure is there to support that, and it can be scaled easily. Like I think you do need the fit, but I also say that with N95, like, people don't understand the fit that is required, the fit testing that's required, and even with our cup respirators, I know that it's not going to have the fit that you would get from a surgical mask with a mask brace. But yes, we are just testing basically the media itself. I guess my point is that the KN95 stuff that I'm seeing, and I haven't tested the Michigan thing, but the KN95 that we're seeing, the media that they use is really low quality in many cases.
Yeah, that's very dangerous.
It's extremely dangerous because people think that KN95 means N95. They're confused by that, and it doesn't. Like, the media itself, like, honestly, we're talking the cheapest surgical masks on Amazon were like 4 cents a piece. That's insane. We can't even make the mask for that cheap. I think they're being subsidized. But the media in that had a BFE or a PFE of 90%. And somehow the KN95 said it must not even have real melt blown in it, to be honest.
Yeah, that's some interesting points. Davis.
Yeah, there's a study published in the Journal of the American Medical Association that was studied the N95s and KN95s and looked at the filtration percentages across a variety of different masks, and I think it came to a similar conclusion that but it's a very comprehensive study, so I'd recommend looking at that as well.
Can you share that, or can you tell me where to find that?
Yeah, I can share that. I just have to. Actually, you know what? It's in the press release or in that survey link that I just shared with Bob. It's quoted there.
Yeah, it's already in the alert, and and so you'll have access to it that way. Yeah, good. Yeah.
Yeah, it's been shared. Yeah. It's basically by the CDC director, and it's a commentary that the CDC director made on August or September in JAMA that references the original study.
But back on the original point, and I think Lloyd's made a contribution. I'd like to get Dave Rousse, in on it. Dan Grayson's also involved in this. Pierre Lindblom of H&V is a major supplier of the melt blowns, and just kind of continue for a few more minutes on the availability, the practicality, let's say, of supplying 3 times as many high efficiency masks as are presently being used, and can that be done quickly? So, and these numbers that I'm showing you here could be way off, but I think it does reflect the fact that, assumably, the medical profession is using a lot of masks per person, but there are not that many people in the profession, and when you start talking 330 million people, it's a lot of people. So, Dave, you might just want to start out and comment, and also tell us about ASTM, because you got the latest information on that.
Yeah, sure. Thanks, Bob. Nice to be with you again. So regarding the media available to meet the demand, as I reported last time, we believe that we've turned the corner on domestic supply of meltblown, and we are no longer in the shortage situation that we were, and it's going to get stronger. Domestic supply will get stronger as some of the machines that have been announced and are being installed will start producing. So I think we're out of the woods on meltblown, which is primarily for those medical surgical face masks. At the beginning of the crisis, back about a year ago, when the need was high and the meltblown supply was low, we did work with the government on incenting some investments, but we also launched a project with one of the managers at NIOSH to develop a performance specification below the medical surgical ASTM specs that would take into consideration other non-woven materials that were not melt blown, but yet could still deliver a reasonably strong level of filtration performance. And there was a very strong supply of that up against a very limited supply of melt blown, which we wanted to conserve for the healthcare sector. Going through ASTM is a laborious process, as many of you would know. And it was accelerated by the fact that the NIOSH person we approached originally ended up being the chair of the ASTM committee, and he did best efforts to push it through. And I'm delighted to report to you today that it is through. And we believe that in early March, there will be the formalization of this new ASTM general public barrier face mask standard, which establishes performance levels for some of the common general purpose face masks that were shown in Sri's first slides. I think this is especially relevant given this week, Dr. Fauci came out and said, wearing 2 cloth masks is better than wearing 1 cloth mask, and still encouraging people to wear a mask of any kind, no matter what the performance of that mask is, because there was no benchmark for performance for a face mask for the general public. Now there is going to be, and it's a standard that we've talked a little bit about before. It's got 2 performance levels, and it has 3 criteria. The criteria that are built into the standard are filtration efficiency using the NIOSH method. So it's PFE with the small sodium chloride particle that Lloyd spoke to. That establishes the filtration efficiency level. The pass-fails are different from 1095. There are 2 levels of performance. One is a minimum of 20% filtration efficiency. The other is a minimum of 50% filtration efficiency. The second performance criteria is pressure drop, which is a a placeholder for comfort. And here, the level 1, the 20% minimum filtration efficiency has to have a minimum 15 millimeters of water pressure drop, which is a pretty low pressure drop. But the higher performance level, 50 plus performance efficiency, has to also have a pressure drop of 5 millimeters of water. And that is very tough. That 5 millimeters is a very tough pressure drop to achieve with a high level of filtration efficiency. So I think that this is going to engender a lot of development, a lot of engineering, a lot of repositioning and material science developments to achieve a high level of efficiency with a very low pressure drop, high level of comfort. The third performance element is fit. And as we talked about before, no matter what your media efficiency is, if it doesn't fit tightly around the face, you're not getting all of the benefits of that filtration efficiency. And I do have to say that this is not the strongest element of this new performance standard. The fit issue was debated vigorously and pursued in great depth, and it's not an easy issue at all, as there are so many different skull sizes and shapes and forms in the North American population, and there are many approaches to how you achieve fit. So the group decided that it really was a hill too high to climb for this effort, and did establish fit as a criteria, but left open to the manufacturers some of the ways to approach that issue of fit. So in essence, they established that they didn't want to let pursuit of the perfect ruin the good, and the other two performance criteria were actually pretty good. So I think, why is this important? Well, when you've got an ASTM performance standard, now you've got something to point to. It's our belief that NIOSH and the NIOSH manager that we were involved with has the complete support of the management of CDC. NIOSH is a part of the Centers for Disease Control, CDC. And CDC is a very credible institution providing guidance to the general public during this pandemic. And they're very credible, as is Dr. Fauci, who's with the Institutes of Health. We believe that with this performance standard for general public face masks, the CDC will be in a position to adjust their guidance to the public from the current status of saying just wear a face mask of any kind to wear a face mask that adheres to this new ASTM performance standard. And that'll be a giant step forward in getting the general population to wear face masks, which actually do something, which is what we're all after here. So I'll stop there. I just want to make one more mention. In early March, INDA is going to have already has set up a series of webinars. One of the webinars, the first one on March 16th, is going to be about the new ASTM performance standard for general public face masks and the design opportunities for players in the game. And I will have one of the ASTM process stewards with me, Jeff Stull, to discuss in detail some of the elements of that new standard and what it means. So Bob, I'll stop there and take questions or allow the discussion to proceed.
Yeah, I don't think we're going to let you off the hook easily here, Dave. You're a fountain of information, and I've got lots of questions, but let someone else break in first.
Dave, did you say that the standards are going to have it below 5 millimeters of H2O?
That's the max to achieve the higher performance level.
Oh, okay. Is that not normal? Ours are right below 5, but I didn't know what the norm was on that. Guidance on that?
It's a challenge to achieve. It's a challenge to achieve a high filtration efficiency with a low pressure drop. I think the N95 pressure drop is around 25 millimeters.
We're using the new way of making melt blown with I'm not the scientist, but we're injecting the static electricity into it with our proprietary plant. So I think that's probably going to be required in any media going forward. I'm wondering if you have any guidance on, for the new types of melt-blown installations that you see going in, like what percentage of them are using this newer process?
I don't know off the top of my head. My guy Brad probably has got a better line of sight on that. We do know that there were not all of the melt-blown machines that are coming on stream are dedicated to the face mask level of melt-blown. Some of them are for sorbents. Some of them are for higher levels of filtration, air filtration efficiency, and then some of them are intended to serve the face mask market. So we believe, we believe we've stimulated a lot of melt-blown capacity, but we also believe that it'll be utilized because melt-blown goes beyond face mask, and it's used in indoor air quality filtration, and it's used as in sorbents, and it's also used in some automotive acoustical insulation materials as well. So I don't have a direct answer, Lloyd, but I think all of the melt-blown will get used.
A question for you, Dave. Yesterday, the president, there was some press that the president is seriously considering sending masks to every American, and that was kind of confirmed by his chief of staff. But they're just actively trying to decide what to do the next few days or the next week. They're going to come up with some kind of proposal. What do you? And then maybe this is a question to everyone on the call. But what should the president do in terms of sending masks to, or either subsidizing, or whatever form it ends up being, vouchers in like Germany? Like what are the masks that should be distributed or encouraged to the country?
I'll start on that. I don't think the problem is that the general public doesn't have adequate access to face masks. As Lloyd said, there seems to be a plethora of face masks in inventories right now. I think the president would serve the public better if he knew about the ASTM standard and said, don't wear a face mask unless it meets this new standard. That would do a great deal more service to the issue, the pandemic, than just distributing face masks.
So what percentage of filtration, and what like specifically, what specs, what's manufacturable versus what is necessary or needed? Like how do we thread the needle on that?
Well, there's a group working on that. Some epidemiologists trying to understand, what levels of these three parameters would deliver the greatest benefit. So, Sri, I think that's still being pursued. Some of the folks that are probably going to be pursuing that. Right now, we can say is moving in the direction of the highest level of filtration efficiency possible of the media with the tightest fit possible, so that all of the air going in and out goes through the media and not through the sides, and then making it as comfortable as possible so that it's not a burden for the wearer, for the person to wear it.
Yeah, I think that's very interesting. Right now, it seems like they're in the decision-making mindset, so it would be very useful to provide some kind of immediate, kind of a unified proposal, if anything.
And we've had contact with some of the members of the Biden coronavirus task force, trying to inform them of what's coming up with this ASTM standard, and trying to get the standard into the thinking process of the administration as it deals with the pandemic. To me, the bright news was that the standards process involves a lot of people with a lot of different opinions, and we thought it might carry out until May, and we had a breakthrough this week and resolved all of the comments, and it now looks like we're ready for early March instead of May. So I'm delighted and elated by that, and think it can now play a major role in the situation.
Yeah, Dave, hi. This is Per Lindblom, HMV. Thank you very much for pushing this standard through. Just a couple of comments from my side. From our perspective, we continue to see a very strong demand on all of our melt-blown assets, and from what we hear from miscellaneous customers is that there is still a shortage in healthcare when it comes to N95 masks. Might very well be that surgical masks are more readily available. When it comes to this ASTM 50 standard, I think that's a challenge to reach for non-melt-blown material. I do think it's very much within reach if you use a charged melt-blown, and I think it's good if we can give the market guidance on this standard. So I think very interesting. Thank you.
Thanks, Per. Yeah, again, the standard was pursued because of the preponderance of cloth face masks out there, and cloth of general handkerchief quality, as opposed to any attempt to maximize filtration. It was more of a visual cover to allow you to go to the grocery store than providing any protection for the individual or for the people around the individual.
Yeah, I mean, all the tests that we have done from our side on cloth masks shows very poor performance. And if you read some of the reports in media, it is that, or some research reports where there are concerns that some of the cloth masks can actually make matters worse as they go from droplets to they perpetuate going from droplets to aerosols. That I've seen in a couple of reports. So having something that is a little bit more rigid, something that is actually offer filtration, I think is something good, so to speak. So
yeah, Per, we've been doing a lot of discussion about using the melt blowns and the essential brace, or one of these other outer braces. The essential brace has been shown to give a very tight fit. So we're looking here at the combination of the various different masks when both the emitter and the recipient, and I saw for the first time in the mainstream media talking about the emitter or recipient and the combination, and actually quoted, although they didn't mention us, they quoted some numbers that we'd put out there. So I think the message is getting across that you really do need tight fitting masks, and that if both the emitter and the recipient are wearing them, it's going to be very high efficiency. And my question to you is, why not, with all the melt blowns that you can make and with the essential brace, shouldn't the fallback position be that if you can't really get a tight fit with something like the Vogue mask, which is very comfortable and elegant and so forth, you're better off with melt blowns than an essential brace and getting the tight fit than you are certainly, with what Sri was telling us this morning. Look over way over on the right, you've got cloth masks that would have less than 10% effective efficacy. So my question to you is, do you see that as a market to pursue, as selling the melt blowns and surgical masks for people who are going to then use the brace to get the tight fit?
I mean, I think the brace is an excellent idea, where you can create this tight fit, because I mean the leak around the surgical mask is pretty large. So I mean, there is still a substantial performance difference between a surgical mask and an N95 mask if you follow the NIOSH protocol, where you actually load the media over time, right? So that's a rather challenging test that requires a high quality melt blown with an inherent charge, and that will last, So, but I mean the brace, it's I think a great bridge from when more efficient material becomes available in the market. Yes. So.
And one question I'd like to pose to Dave again is the fact that ASTM didn't resolve the fit aspect it seems to be disturbing. Obviously, as we just reported, a 2% leakage can give you 50% of a 2% gap can give you 50% air leakage. That without any way to verify fit, are we back partway into where we were before, where the mask isn't really? We don't know whether the mask is going to be effective or not. So, how did ASTM address that issue?
So they didn't ignore it. They raised it as a necessary performance criteria. It's just that they didn't establish fixed and firm test procedures and pass-fail limits to guide the design. And again, it got into all kinds of different face sizes, skull shapes, gender issues, nationality issues. It became a very cumbersome issue to deal with in this particular forum that had somewhat of a timeliness attached to it. So they spoke to it, and they did prescribe two different approaches to fit. One left a lot of discretion to the face mask designer and marketer to just document their approach to fit, and another one did prescribe, the other method option did prescribe a little bit more closely an approach that does deliver fit. But I'm not, it didn't rise to the level I would have loved to have seen. But again, there was a timeliness to the effort, and we did not want to let the perfect be the enemy of the good. I think we got something good here, but it's not perfect.
Yeah, I think with a fitter, I mean, a brace or whichever term people like to use, once you use it with a surgical mask, you can't go back. I mean, it's almost like it's a no-brainer to add the fitter now, and it's only a question of awareness and people realizing, wait a minute, I didn't know I could tie my shoes. Once you use shoelaces, you can't go back, and it's really kind of not that too different. And I think the other question with the surgical masks that I still kind of not sure I know the answer to is, people when they wear N95 masks at the end of the day or at the end of a week, they test the filtration efficiency, and it's still around 90% according to Lindsay Marr. Do we have any data on that with the surgical masks? Like at the end of the day, after using it for 8 hours, what the filtration efficiency ends up looking like, even though initially it might be 90% or 95%?
Anecdotally, that we do with our own. This is Lloyd again. Ours test, like I said, around 98, 99%. And after 12 hours of use, I don't see any drop.
Wow.
So, I mean, maybe like 0.5% or something like that. We do recommend that people switch out the mask every day. And fortunately, since we're talking about something that costs like 20 cents, it's cost effective to do so.
Is that true for the cheapest surgical masks that you were testing on
I
Amazon?
wouldn't recommend anybody to use those cheap masks, so I don't have the kind of the source material.
Yeah, I think I'm not sure what the variability would be between these different materials. That's calling it one category as surgical masks or have 90%, it runs the risk of saying that all surgical masks are going to be 90% at the end of the day.
Well, point of fact is a surgical mask in the United States is an FDA regulated term. So to call something a surgical mask means it has to be ASTM level 2 or ASTM level 3, which means the filter media needs to have a PFE of 98% or higher. And so in those cases, and I think the delta P, by the way, has to be below 6, I think, to meet those standards.
6 millimeters of water?
Yeah, I believe that's the ASTM standard. And so, if that's the case, then we're talking about a higher quality surgical mask to begin with. The challenge is like people conflate surgical with any blue mask, right?
Yeah.
And they're not the same thing.
Well, I think you have to be a little bit careful when you mention efficiency. I mean, if you talk about a surgical mask having 90-95% efficiency, I'm not sure what the particle size is But my experience is that a surgical mask have maybe 98, 99% EFE efficiency. And if you look at the standard, that's being close to a 3 micron particle. If you use the same filter media and you test it, according to the NIOSH standard, then it has, I don't know, 60% maybe, some along that line.
So that's actually a misnomer. So a lot of those studies that were done were before 2017, when TSI, the machine that makes that device, changed the shape of the machine. So the cup of the respirator of an N95 respirator allows a greater surface area of breathability and testability, and the TSI machines have this tiny little hole in them. So the old ones did. And so when you put a surgical mask over that, it only tested a very small area, which is why the NIOSH standard for some of those tests showed up really, really poorly. But after 2017, they changed the machine. And now now it tests the full surface area of the mask, of a surgical mask. So it actually tests much, much higher. The newer studies are all in 95% or plus. And actually, we use the same testing media as NIOSH does, the NaCl, in our PFE machine for testing. So I can tell you from personal experience that they do test very, very high.
Yeah. Well, we never test mass. We test flat sheet. So it's a little bit different. But okay, all right. So
I can send you some data on this if you'd like.
Oh, I would be happy to see it. Yeah, please.
Yeah, in fact, if you'd send it to us too, we'll make sure that everybody gets it. That would be very helpful.
Yep.
Yeah, before we actually go, we do want to get to the 3 steps, but a couple other things we tried to do is to get a handle on how much difference the mask could make given the vaccines. And you can chart how soon people are going to be vaccinated, and of course whether there's going to be 60% effectiveness or 95% makes a big difference in things. But certainly in the wealthy countries, by the end of the year, more than 60% of the people will be vaccinated, and therefore the efficacy of masks, or the value of masks, will be less than it would be otherwise. But the combination of masks and vaccines, which is the both here, compared to just the vaccines alone, gives you some idea of the value of the masks. And
well, I think there's actually an important point here, which is that there's a risk that we may not reach herd immunity with vaccines. I think that medical professionals are raising that now because there's the virus is getting more contagious, and to get the herd immunity, you need a much higher percentage of people vaccinated. So it may be that there's just running a risk that we're too slow with the vaccine, and it may not even be enough.
And I think we would all agree, since we are focused on masks, that looking at vaccines without masks to achieve the results, you're looking at a probably a weaker rather than stronger tool here. And obviously the masks themselves in the blue line here are and particularly with this program, are going to make a lot more difference and save a lot more lives over the next 4 or 5 months and 6 months if we could get it up and running than the vaccines themselves. But together, they're going to make a big difference. So,
agreed.
So again, this is very unscientific. We need to start quantifying it, but it does bring out the concept anyway of looking at masks and vaccines versus masks alone, or versus vaccines alone, which people are kind of oriented. Okay, we only get out of this when we get the vaccine. Well, if you're wearing the mask, you're out of it a lot sooner and so forth. So,
well, there's an important distinction between the vaccine and the mask. And I think this was kind of it's a subtle point, but important one, which is that the vaccine protects you whether you're in the household or outside the household. It protects you 24 hours a day. The mask only protects you when you wear it. And realistically, people are only going to wear it when they're outside the household. So it's not going to protect them, the transmission from inside the household, practically speaking. And so there's a little bit of a difference in how we model them, the effect, and then maybe the filtration efficiency also plays a role here. So if the mask is not perfect, that also impacts how useful it is. And so we kind of have to work out the trade-off a little more quantitatively to really know what percentages are actually needed. They're not exactly equivalent, in other words.
Yeah, I think you make some very good points. And this line on the mask makes a lot of assumptions about the efficiency of the masks, where they're worn, et cetera, et cetera.
Yeah.
But I do think people have to start thinking in terms of what happens if we have both the masks and the vaccine, and how many lives get saved.
Certainly.
But to your point too about we may never get out of it, Fareed Zakaria, said last week he doesn't think we're ever going to get out of it. And one of the reasons he cited was that vaccines are not going to be available in the developing countries for years, and all the variants are going to bring back to the United States. Our variant viruses are coming back into the United States that are going to start new pandemics. So he's pretty pessimistic on that regard. But again, we need a mask program in the developing countries, and I think there's an argument. We said, okay, what if this group of people that's making sure that effective masks are available and used in the wealthy countries, if they then wait a few months before they start pushing this on the developing and poorer countries, when the mask requirements start to go down in the wealthy countries, then you turn to the poorer ones, and that's what this is. And obviously, this is a way to look at it from a mask manufacturer's standpoint. Let's not push us to where we're making more masks, next month than we'll have to make 5 years from now. Let's do it gradually, and we make the most amount of money by waiting for the developing world until we satisfied the needs in the developed world. Now, and that's what this looks like, but and it's probably more realistic. But there are lots of arguments that the richer economies are going to suffer more by not subsidizing vaccines, but I think you could substitute masks in the developing world because of the loss of economic progress, and just maybe even some of the health risks coming back to the United States. But I think it was basically just on, it's a world where we're trading, and all these people are either suppliers or purchasers or both, and so the effect on the world economy is such that the developed worlds can justify spending the money for, they said, vaccines, but I think you could substitute masks here.
It's an interesting point about the developing world. There's a peculiar case of India in all of this, which is that there's been recently a bunch of articles, NPR, Wall Street Journal, pointing out that suddenly the rates of infection, of hospitalization, of death, everything just fell off a cliff. It's all gone down for some reason. And some are attributing it to the more consistent use of masks in India. I don't know how to verify that or if it's true or not, but that's what the articles are saying. And that's if you read the news of the headlines, it's kind of remarkable that even though the virus is growing in other parts of the world, it seems to be on the decline in probably the largest developing country outside of China.
Yeah, that's interesting.
Yeah, I was kind of surprised to see that myself.
Yeah.
So there's some assertions that the mask utilization, they step it up with fines. Like in Mumbai, they have fines. You know, if you're not wearing a mask, they'll fine you, and various other measures that somehow or other they were able. There seems to be some change. Whether we're not clear if it's weather, or if it's masks, or if it's who knows what it is. Mutations, hard to tell.
Yeah, we'll check in on that too. We are trying to track everything going on in India. In fact, I spent most of the morning yesterday morning with 30 or 40 executives in India. So we're going to pursue that. The back on the whole three-step program again. I think one way we've been covering the three steps, and in the daily alerts, you can go in by the headlines. You can go in by a keyword. If you want to go in just like brace, you can get brace or whatever here and find everything. But an effective way to do it is to go in by the headlines and then pick the alert that you want to pursue with the information on it. And the last few alerts have each one of the steps. So what we're going to go do is to go down to the January 29th, where we did the step one, and this basically was the presentation that Sri and his colleagues made, and we went into all these different step one. Well, he went into all three of them, but then we went into just his step one in this particular alert, and all of you have access to it. One of the things I wanted to do was to ask you about BARDA. If anybody else, we do have some NIOSH people, I believe, on here too. I don't know if anyone wants to say anything, but BARDA came out with an RFQ along the lines of what our whole mission here was, the three steps, and wanted guidance on how to evaluate the effectiveness, how to get the message out, and all these different things. So anyway, that is covered in that alert. You can go back and look at all that. Then the next question here. In fact, I see Monica just joined us. If Monica wants to have any, Monica is a doctor in this whole area, and we'll welcome her. She was not going to be able to join us initially, and she has joined us. So Monica, please jump in at any.
Hey, nice to be here with you. Thank you.
Yeah. So maybe just get an overview of you. You were involved with this paper, and Shree's been telling us about it. You might just want to give us a little of your perspective on the situation.
Yes, I mean, I actually just listened to the C-SPAN White House briefing this morning, where a reporter asked a question if the mask mandate by President Biden has made an effect. And I think it was interesting what Dr. Walensky said from the CDC, which is that likely it did. Likely it has already, especially with the decrease in cases in the United States. I think we have, she is indicating that, there's many things that are going on clearly with our cases decreasing, but I agree with what was just said about India and the United States, that putting in, mandates essentially and asking for people that they have to be wearing masks on these different settings could be having an effect. And then what Dr. Fauci said, and has been saying all along, and totally makes sense, is that we need to do this. Our vaccine effectiveness will actually be better if we have lower rates of transmission. That is just a known phenomenon with vaccine rollout, partially because of the ability of the virus to mutate, but not just that. It's more effective to be vaccine rollout when we have reduced cases. So that's what led us to, put this out so strongly that it won't take that long. But to put a mask blitz out there essentially is really indicated at this critical time when we're rolling out vaccines.
Well, that certainly is something I think we would all agree to, but interesting perspective on it. The so continuing here, so this is where we started the three-step strategy, basically on the 28th, and then we went on to step 2. That was step 1 that we talked about there. And then on February 1, we went on to step 2. So let's pull that up here. And so again, this was a discussion or a need in step 2 to go into the different types of mass. I think we've been covering that pretty well, and I think there's agreement that there is the ability to get very high efficiency, and certainly the ASTM is a good base point and educational tool. And once you have at least a base that you have a mass with a minimum efficiency on it, you're going to eliminate a lot of the completely useless mass and make people even more receptive to getting the highest efficiency. Now, one thing I'm not sure whether Ron is on from SGS. He signed up, but it occurs to us that a couple of the companies worldwide, SGS with 40 or 50,000 employees around the world, and Eurofins is similar, that they actually are certifying these mass, and they essentially can do so for any kind of a level. So I'll just look and see if that was down here. I don't see it, but anyway, these companies are worldwide companies that, and Lloyd talked about the quality of the mass being shipped in with very bad media. Well, both SGS and Eurofins, have quality control right at the source of manufacturing. And then they have a seal that they can put on that shows that the mask has been tested, the individual masks have been tested, but that there's quality control for the whole line of masks, et cetera, et cetera. And so that and underwriters is another group that's in that as well. But it seems like, the ASTM could be the basics certification, but people would then strive to get labels of even higher efficiency. So I think that's not an unusual combination where anything out there has to be of a certain minimum quality, but you try to get a rating from somebody that shows that this is even higher. So, and anybody has any thoughts on that end of it? But that would be one of our thoughts relative to some of the step 2 type making decisions between mass. That being said, then that was February 1, and then we go back here a little bit. So February 2, we got into the step 3, and this is basically how do we prioritize mass for the vulnerable. And I guess when we talk about the vulnerable, and Sri, you might want to weigh in on who you think we're talking about when we talk about the vulnerable. Yeah, Sri may be on mute here.
Oh yeah, here I'm back. I'm back. Yeah. When I say the vulnerable, I think this is a concept reflected also in the prioritization of the vaccines. It's been very carefully determined. But generally speaking, if you follow the model of Germany and Austria, to flatten the curve, we need to keep the elderly safe from coronavirus, so that they, and I think that the elderly are obviously one group that's more prone to death and hospitalization. So they've decided to send FFP2 masks to the 65 plus or 60 plus populations in those countries, and that's similarly, very clearly one group that needs to be protected. The other group, very obviously, is the essential workers, people who are exposed day in and day out to each other as they work, or to customers, in retail, in fast food restaurants, in agriculture, and manufacturing. I think Monica actually done a ton of work on this with looking at meat packing plants and exposures there. So there's clearly multiple groups who are considered more vulnerable, maybe due to medical conditions like and so on. And so this is a but it's a well-defined group. And I think prioritizing the access to these, if there is a shortage, if there is a limited supply, prioritizing access to these masks to those groups does seem to make sense.
Yeah, if I could just add here, one thing that in the first 2 days of the President Biden administration, he signed a slew of orders. And one thing that he signed was asking OSHA to be really clear about the masks that will need to be worn in different workplace settings, indoors being more crowded. And we really do need these kind of regulated and standardized masks for different settings. The CDC is putting out an MMWR article on Monday where they are planning on listing masks essentially for different settings. And I think that is going to be really helpful, because right now there's sort of a slew of different options and it's very confusing. And now there's lots of headlines about double masks, but without any clarity on what that means. They are actually not going to endorse specific. Apparently, they're going to endorse absolutely different options in kind of the way they said it to me is the way that we thought about HIV prevention, that there's some option for this setting, another option for this setting, and I believe that will be very clarifying on Monday.
Will that specify mask efficiency, or how detailed will it be about the description of the mask?
So you're right that they are also extremely aware through the work of this group and others that we're looking at two things that we care about: fit and filtration. That is really, we want to increase fit and filtration. And there will be different, I'm not privy to the actual document, but apparently there'll be different ways to increase fit, which the ways that we've already spoken about on this webinar, tightening and different ways to keep it closer to the face. And then in terms of filtration, they will take into account the electrostatic repulsion of certain materials, the cloth barrier being high quality mask for other. So I just found this out. And I'm not certainly privy to exactly what it looks like, but I think it's going to be really helpful to have a listing of these different options using those two key parameters of masks.
MMWR is a research journal, right? Is this going to be some research that they're publishing, or is it going to be official guidance from the CDC?
So I asked, I actually had a conversation yesterday, and I also was wondering, there's the format of a scientific brief, like their November 9th scientific brief, CDC brief, that said that was for the first time that we said masks protect you and others, at least by the CDC, which was a great thing. And then, but it was specifically, the word was MMWR. So again, I'm throwing this wrench into our webinar 2 days before Monday, and so I genuinely don't know. But I'm curious, and we may be able to help with a follow-up webinar after seeing that.
Yeah, that's certainly very interesting. Now, tell us.
Yeah, it was quite a update. Yeah.
Now, how will we access this exactly? Where will it be showing up?
It will be widely available on the morbidity and mortality weekly report. So whatever is happening, there's big news on Monday. But again, that's all I can shed light on, because that's all I heard about.
Yeah, that certainly could be very, very important.
And I was told that I'm allowed to say it, that something's coming out Monday.
Okay, that's great. Well, I think we're coming up on the hour and a half here. I'd like to give anybody a chance to ask some other questions before we sign off. Any thoughts or questions or comments that people would like to make? If not, we'll certainly look forward to this information on Monday, and some of the other performance information that was promised during the discussion today, and we'll see that that gets up in the alerts here and on the website. I'd like to thank everybody for a very interesting discussion, a lot of valuable information from a lot of different people. And we're ready to do these on any relevant subject anytime. So let's work on doing the next one.
Yeah, Bob, I have one request of the audience. I think it does seem like this is a time when people are trying to figure out what to do. And so to the extent that we can give people immediate options that they can that are actionable right now, that would really help. And I know everybody's trying to do that already, but to the extent that we can publish in the press or get more word out there on how to go past the cloth mask or these memes about that are flying around about masks and get really solid options, it really, I think, would help a lot of people.
Yeah, I mean, we could take a try at doing a white paper, so to speak, here over the next few days, and then run it by you and some others, and try to get a group buy-in on it, and using a lot of the information we've been gathering here.
Great.
Or we're certainly open to suggestions from anyone. And by the way, this particular website is available to anyone. It's free of charge, and ways that we maybe can change or make it more user friendly and so forth are welcomed as well.
Great.
Okay. I'd like to thank everybody, and we'll look forward to talking to you again.
Thanks, Bob.
Okay, thanks a lot.
Thank you.
Bye now. Yeah, I was trying to get the. I tried that. Oh, there it is. Yeah. Okay. There's. Yeah. There's. Yeah. Yeah.